You've been coping with this for a long time now. Has it got any easier for you?
Yes, I think definitely. I think the last 10 months for me have been excellent, and I've really started to deal with it and to accept that this is going to be part of my life now.
So, Dr. Lowe, why does this kind of thing happen?
Well, I think we do know quite a bit about alopecia areata, and one of the keys. Do you have a family history, Danielle?
I do, yes. My mum suffers as well.
And that's a very important factor, and there often is a family history, so there's a genetic basis to many people. What we think is happening is that there's an immunological switch that stops the growth of the hair follicles. You don't lose your hair follicles, you've always got hair follicles there. So there's always, that's important because there's always that opportunity to get them started growing again with various treatments.
And is there a trigger that sets this off?
There's a number of triggers. Did you have any triggers as regards stress or real emotional problems?
When I lost everything, I was just coming out of a quite long-term relationship, which was very stressful. You know, I'd been living away from home at university, and I'd also had glandular fever about 6 months beforehand. Yeah.
So what about treatments?
Well, one of the difficult things is when we diagnose alopecia areata, patients somehow expect in this day and age that we can miraculously get them their hair back. And there are things we can try and do to dampen down the immune system, because it's the immune system that's stopping the hair growing. But there is no one treatment that works for everybody.
And so what would be the next step now for Danielle?
Well, I think one of the encouraging things about you, Danielle, is that you've got eyebrow growth now, that you've actually got some growth on the scalp, and you have got some body hair growth back, so you've actually become less severe. The other thing that's important is that 50% or greater of people with alopecia areata will spontaneously recover. So it is important to stress that.
Particularly if you don't worry about it, because you can get in the vicious
so hard, easy to say, isn't it, and hard to do. Do you think you'll carry on trying to find the cure, or will you get to a point where you just accept that it might not grow back?
I think I'm at the point now, and it's taken me 10 years to get here, where I've just accepted that it might not grow back. What I'm keen to do now is help others going through that difficult time, you know, to deal with it, because I think, as you said, it's, you know, the worry and the stress can often make it worse.
Absolutely. Well, I've got to say, Danielle, thank you so much for sharing your story, and
Thank you for having me.
you are a real inspiration.